you tell us a little about what a family systems approach to treating addiction would look like for a young person?
That's a great question. In the 1950s, a psychiatrist named Dr. Murray Bowen developed a theory called family systems approach, or family systems therapy. Basically, what that means is that the entire family has emotions running through it and has a style in which we relate to each other emotionally through our communication. And it's very effective with teens and their families, or young adults and their families, because it really speaks to the fact that while the individual may be receiving treatment, the family also has to receive treatment as well. Those early formal messages that we receive from our own family members play out as we parent our children. And by doing family therapy work, there are times where you have to separate the parents and you have to say, I want you to work on this message and how you deliver it to your child. Dad, do that. Mom, same with you. Deliver this message to them. And it's about learning communication. It's about learning the system and how you work together as a family and how you don't work together as a family and how you can change the way you respond to things. And it's also about allowing the teen or the young person to individuate from you. That means let them stand on their own 2 feet. If they make a mistake, they have to learn from that and grow from that. The natural instinct of a parent or a family member is to do what? To rescue. So the family systems is, again, the patient is the family is the patient.
Cheryl, I remember when I went to the family education program and started learning about the disease model of addiction and learning so many terms, including this, what seemed sort of like I hadn't encountered before, this kind of big umbrella term of process addictions.
Okay.
And that things like gambling and video gaming and even shopping could be classified as process addictions. Could you talk about those a little bit? And is sex addiction something that fits under that pretty big umbrella?
Yes, so process addictions are generally considered behavioral addictions or compulsive behaviors that are not behaviors that don't balance out, that become compulsive to the point of addiction. Oftentimes what you'll see with folks who have a substance use disorder is the brain is already hardwired. The neural pathways light up because the substance creates a soothing or an amped up feeling. There's always a reward to it. So if you think about a process addiction, those same neural pathways light up in the brain. And for someone who has a substance use disorder, they might put down their substance and find recovery to that, but they find something else to self-soothe. And that might be, I'll just pick on food. Food is something we all need to put in our body, but you can become addicted to that. Anything of too much is not good. Sex addiction, interesting about sex addiction is, a lot of people believe there's sex addiction. A lot of people say, another camp will say it's just sexual compulsivity, and who has control over that. As a trained therapist in sex addiction, what I often see is individuals who can't control themselves in terms of their thoughts and their behaviors, and they put themselves in risky situations. So what does that sound like? That sounds similar to the person who has an addiction who starts to, go down the street in the bad part of the neighborhood and trolls for their substance and puts himself in such high risk situations. So it's progressive, and it also lights up the same neural pathways of reward. So gambling, same thing. You can do the ka-ching, and if you're someone who's already hardwired for the disease of addiction, you're not just going to stop with that $20 that you may have just lost in that slot machine. You're going to want more and more because you're hardwired for reward. And it's very progressive. The disease is very progressive. What I treat is called addiction interaction. Oftentimes, I will see individuals who come in for substance use disorder, and while they're with us and they start to clean out the cobwebs and the substance is no longer in their body, what you'll see later is some of these other process addictions kind of come to the forefront. And then you have to treat them together because they interact with one another. They confuse with one another. So oftentimes with sex addiction, some of those individuals might be using cocaine to energize themselves performance-wise. And without the substance, they feel as though they can't perform. So it's fused together to get to get a bigger bang reaction out of it. And then there's replacement. Sometimes replacing one addiction with another can sometimes occur. We do treat and educate our patients at Cairn around what is addiction to interaction, and sometimes they even self-diagnose.
Cheryl, I understand you're trained in the use of art therapy for those dealing with addictions. I've heard of art therapy as a tool for young children. How does that work for those seeking effective treatment from addiction recovery?
So as a trained art therapist, certified in art therapy, it is another technique in order to allow the individual to find a way to express themselves, especially with young people. And art therapy doesn't have to be with children, as you mentioned. It could be across the lifespan. I've used it with older adults who are 85, 90 years old, and they're reminiscing, okay? Or they're looking at their family system through pictures, collage work, etc. But especially with art therapy, what happens is it really accesses the right brain. The right brain is the part where creativity lives, emotion lives. The left brain is where reason is. You know, that's that kind of black and white thinking. You know, the everything has to have its perfect little box. And with art therapy, you're really keying into allowing the individual to express themselves in a nonverbal way. There's no right or wrong to what they might draw or sculpt or paint. It's simply taking what you're unable to access inside of you feeling wise, putting it out in front of you in a piece of paper or however, and being able then to reflect on what was that like for you. We do trauma art therapy work. A lot of trauma victims hold a lot of those deep secrets inside of them, and it's one way for them to release some emotion. And then there's art as therapy, which is just the making of art. And when I talk about art, I talk about music. You know how music can either energize or soothe you? Art can either energize or soothe you. And it's a bit of a mindfulness practice. And it's a way to access words where maybe you can't find the words to express what you're experiencing. I've done art therapy with every client you can think of over the years, and families, as a matter of fact, where I might put them around a table and they work on a project together to start to establish what is it like to communicate when you're all reaching for the glue at the same time.
Cheryl, in your opening statement, you mentioned that you're trained in DBT.
Mm-hmm.
What is it? Is it used for mental health conditions that don't involve drug abuse? Is this some relatively new sort of treatment, or has it been proven successful?
So DBT stands for Dialectic Behavioral Therapy, and it was started by Marsha Linehan. And Marsha Linehan has described herself in her writings that she suffered from a personality disorder called borderline personality disorder. One of the hallmarks of borderline personality disorder is all or nothing thinking. We can all get into that. We don't have to have that diagnosis. All or nothing thinking. We're either all good or it's all bad, and we can't find the middle. So dialect is how you see those polarities and how you find that middle. It's really similar to cognitive behavioral therapy, where the things that you think have a reaction to how you feel and ultimately behave. And you can reverse that. Behavior comes first with someone who's impulsive. Then all of a sudden they say, oh, why did I do that? And then there's a feeling of, geez, I'm either going to keep on just being destructive, or I'm going to say, geez, I have remorse over what I did. DBT with parents, particularly with teens and young adults, there's one approach called walking the middle path. So splitting is a dynamic where it could pit the parents on either side. You both get chaotic with one another. And what do? They walk through the middle. and they can go on and do what it is that they keep on doing that disrupts the family system or the couple, the parents. So walking the middle path is how do you bring all parties together so that they can walk in harmony in being able to validate each other through listening, through carefrontation around how do you confront a behavior without being angry or hostile about it, but do it in a loving and caring way. And it's really based on actions, behaviors, and thoughts.
Thank you.
You're welcome.
Cheryl, I understand that one of your areas of specialization is the treatment of women. Are the approaches for women that different from what you do with men?
Well, not really. I mean, there's some areas in the treatment of women that are a little different. I mean, we're hardwired differently than men. We tend to be more emotional than men. And we also, as it relates to substance use disorders, we end up finding ourselves later getting to treatment and much more progress in our substance use because we're caretaking for our families, we're raising our children, we're trying to balance home and life. And I'm not saying that men don't have that, but women tend to not end up getting or seeking the treatment that they need or the assessment because they're afraid that they're not going to be able to care for their children. So they'll wait longer and they come to treatment with more depression, more anxiety, and more complexity around mental health issues. Women also do really well with other women, no surprise. There's nothing like sitting in a group of recovery with other women who have journeyed, just like men in a recovery group together, and the peer camaraderie and the journey and understanding that you have others who've been where you've been, and you're going to be able to do this. And recovery at the end of recovery in this process is an incredible gift. Women also naturally, physically are different than men. So we store more body fat. And because we store more body fat, we can get drunk much faster and high much quicker and not really function very well. But I've also seen women who come to us for treatment also have a lot of trauma. And about 85% of the women that I treat, 85 to 90% of the women I treat have had some form of trauma in their life. Again, a really good assessment around trauma for men and women is important. Men, on the other hand, they tend to find themselves in emergency rooms more than women, believe it or not, and they have a higher rate of overdosing than women. And they also have a higher mortality rate than women for overdoses that become lethal.
Wow, that's really interesting. I've been reading lately an awful lot about the overdose numbers having gone up ever since the pandemic started, even higher than they were before the pandemic. Do you think that isolation is the primary contributor to this? Are there other factors? What is going on?
Rita, that's a great question. I actually researched that today too, because I wanted to know what the numbers were. So the National Institute for Health, it says that 81,000 drug overdose deaths occurred in the United States in the 12 months ending in May 2020, the highest number of overdose deaths ever recorded in a 12-month period, according to the recent provisional data from the Centers of the Disease Control Prevention, the CDC. And that includes, while overdose deaths were already increasing in the months preceding the 2019 novel coronavirus COVID-19 pandemic, the latest number suggests an acceleration of overdose deaths during the pandemic. So yes, people were not able to go on with life the way they knew it. You know, we all became isolated. People weren't able to go to work. You weren't able to have that contact with other loved ones being in your home. And if you're someone who's struggling with a substance use disorder, you're going to be in isolation. And we know isolation is not good for someone who has a substance use disorder or a mental health disorder. So the rates of suicide have gone through the roof. Substance use has gone through the roof. And I think we have a lot of work ahead of us as healthcare professionals to help those people regain some connection. One of the beautiful things, though, is that we've really opened up a virtual world for AA, NA, support groups to happen. But again, you have to help the person access it. And I think we're going to see higher rates of depression, more admissions to residential, the highest level of treatment, more people coming in for assessments. And I think as people get back to work, I think places of employment are going to see some deterioration in their workers, and it may be due to substance use or mental health issues related to the isolation.
Cheryl, thank you so much for joining us.
You're quite welcome. It has absolutely been my pleasure to be here this evening with you.